palate is caused by abnormal facial development during gestation. A cleft is an opening or gap created by the non-fusion of the body's structures that form before birth. Clefts don't always form on the lip. They can also form in other parts of the face, such as the forehead, nose, cheek, and eyes. 1 out of every 700 children born either have the cleft lip and or cleft palate. Cleft palate varies between ethnic groups. High prevalence rates are reported for Native Americans and Asians, while Africans have the lowest prevalence rate. A cleft palate may be treated in the early stages of a child's life or right after birth. Cleft lip has been documented as far back as 500 AD, and recordings of possible attempts to repair it in the 1500s. It wasn't until the late 1700s that there was a successful repair. In 1764, a French dentist successfully repaired a cleft velum, which is the hard palate at the lip. Later in 1816, a German surgeon was credited as the first successful repair of a cleft lip, hard and soft. The cleft lip or palate is noted at birth by the presence of a cleft in the upper lip, either on the right or left of both sides of the lip. A cleft can seem obvious, but sometimes it is covered by the lining or mucous membrane of the palate. Happens to be covered, as is later known as a submucosis, and is not visible to the eye. Babies born with cleft lip and or palate have a good prognosis, and 80% will develop normal speech. There is no way to prevent clefting, but avoiding harmful substances seems to reduce the risk. This disorder are environmental insults or genetics factors. The Human Genome Project hopes to identify all the genes that make us human, which would help us to better understand the genetic causes of cleft lip and or palate. Factors that increase the risk of a cleft lip are pregnancies in women over 35, teenage pregnancies, and consumption of tetrogenes during the early months of pregnancy. About 22% of clefting has a genetic origin, and cleft lip and or palate is a dominant trait. The treatment for cleft lip and or palate is quite simple. Once an infant is born with a cleft lip and or palate, they are then put through surgery. The family can afford it. When a child is born with a cleft lip and or palate, it makes it difficult to breastfeed and sometimes impossible. Later in the child's life, a cleft lip and or palate is not fixed, it can cause many ear infections, and the child may not be able to eat regularly. The surgery for cleft lip is put into preparation right after birth, if the infant is 10 pounds. If not 10 pounds, 10 weeks later the surgery is performed. The cleft may be taped, reducing the width of the cleft. The surgery for cleft palate is performed when the baby is 10 months old or starting to make sounds of speech. Some children may need a second palate surgery or speech therapy, while most children will need braces and alveolar bone grafting to fill the remaining gap in the gum line. There is really no way to prevent cleft lip and or palate if it happens to be genetic, but there are ways to reduce the risk of a child getting cleft lip and or palate. When the mother is pregnant, she should refrain from drinking alcohol, smoking, and ever using medicine. If a woman is over the age of 35 or has a teenage pregnancy, their children have more of a risk of developing a cleft lip and or palate.